There was a Michigan dentist. So this was, there are landmark cases that happen in our careers where you think, wow, that was a pretty big settlement, or that was a pretty big, um, financial cost that came to the malpractice for that doctor. So we do look at those as benchmarks to sort of set precedent. And obviously I always read them too for learning opportunities to, see. I know Jeff does this with his expert witness stuff. We're certainly flawed and susceptible to human error, and recognize that that's a daily part of the risk that we take as clinicians. So when you read these cases, I do come at it with a level of humility to say, could this have been me? Could this have been a scenario in which I found myself in? Quite frankly, in reading this story, I do have to say, at least based on the information that has been published about the case, I'm like, oh dang, like that snowballed really quickly, and unfortunate for the doctor. But there was a Michigan dentist who just settled a case for $400,000 for a patient who experienced brain dysfunction and other complications that came from an extraction. The extraction took place back in 2017, where they removed an upper maxillary tooth with a sinus exposure. And what came from the sinus exposure led to a significant, according to the documents, led to a significant sinus infection, which then ultimately led to the patient being hospitalized for 17 days, where she had to be intubated, was diagnosed with encephalopathy, respiratory disease, and acute kidney failure. She obviously came out of the hospital to live to see another day, but certainly had complications from treatment. And that particular general dentist has agreed to settle the case. For me, in reading that story, I was like, well, it's just a really unfortunate series of events that occurred. And maybe there were some underlying issues that were going on for the patient that, came to an ugly head after the extraction. But certainly could happen to any of us. So that was an interesting story. On the flip side, what made national news this week, and if you haven't heard it, you must be living under a rock, because even I heard a patient of mine tell a hygienist about the case today, of the Minnesota dentist who performed 20 fillings, 8 crowns, and 4 root canals in one single visit. She is now suing her dentist for pain and suffering, embarrassment, emotional distress, and disfigurement as a result of this long procedure. Here we have probably a situation in which the patient likely was sedated. They went to do a significant amount of dentistry in one setting. And then, the patient had challenges post treatment related to that amount of dentistry being done. This just came to light in the last few weeks. This was a case that occurred back in 2020. So we'll see how this sort of plays itself out in the news, and whether or not this patient will be victorious in this lawsuit. But certainly, on our radar as well as we watch these cases unfold. Lastly, for this week, Pearl, who is a proud educational partner of Dentists in the Know, received a U.S. patent, official U.S. patent, for their computer vision software, which is the core of its artificial intelligence within its software. So they received the patent. That is patent number 11,776,677, in case you were keeping count. The computer vision based analysis of provider data. So we're seeing more and more of the evolution of AI and AI support within dentistry and the diagnostic tools as they're coming to light, and also watching these companies sort of grow and obtain the certain certifications, notoriety, and protection of their intellectual property as they are sort of pioneering the latest evolution in dental care for us practitioners. And with that, that's the news.